I'm Sabiha Essack, South African National Research Chair in Antibiotic Resistance and One Health, a pharmacist by profession and professor in Pharmaceutical Sciences at the University of KwaZulu-Natal in Durban, South Africa. I am an expert consultant on antimicrobial resistance to the World Health Organization Africa Regional Office, the founder and co-chair of the South African chapter of the Alliance for the Prudent Use of Antibiotics, as well as a member of the South African chapter of the Global Antibiotic Resistance Partnership. I believe that pharmacy personnel are pivotal protagonists in the containment of antimicrobial resistance based on their knowledge, availability, accessibility, and the validation role. In terms of knowledge, as the primary custodian of medicines, pharmacists have extensive knowledge in the pathophysiology of infections, indications for the use of prescription and over-the-counter drugs and medication, dosage forms that best suit their patients, mechanisms of action, side effects, drug interactions, and contraindications. The pharmacy is further frequently the first point of contact with the health system, and the pharmacist has in-depth knowledge of community and individual health profiles. In terms of availability, pharmacies carry a comprehensive range of prescription and over-the-counter medication that are immediately available. In terms of accessibility, pharmacies, specifically community pharmacies, generally outnumber GP practices in most countries and have longer trading hours, facilitating access to healthcare at all hours. And finally, in terms of validation, as the intermediary between GPs and patients, pharmacists are best placed to validate and confirm the prescription. Promoting the pharmacist as the primary healthcare professional for the management of upper respiratory tract infections would enable patients to obtain the expert knowledge they seek from someone they trust. Patients will have easy and wide accessibility to a trusted healthcare professional. They will receive expertise in assessing their symptoms and ascertaining or determining whether physician consultation is appropriate. It should be, however, noted that these skills are not consistent across countries. Further, the expert knowledge of a wide range of symptomatic medicines is available by a pharmacist, allowing a tailored approach that meets patients' individual needs. The pharmacist is able to reassure the patient on the natural course of upper respiratory tract infections. He or she is further able to educate on antibiotics and the lack of efficacy in virally based upper respiratory tract infections, and there is obviously a cost benefit for the individual patient and the community. So I believe that pharmacists are ideally positioned to play a leadership role in the management of upper respiratory tract infections. Pharmacists are the pivotal P in the 5 Ps. They validate or confirm prescribing practice and thus have oversight of prescribers. Pharmacists are strategically placed to educate patients and effect behavior change in terms of patient demand for antibiotics. Pharmacists are critical to the implementation of policy as well as the generation of evidence to inform policy-related interventions. And pharmacists prevent antibiotic resistance by impacting on prescribing practice, patient behavior, and policy implementation. Not all pharmacy staff are equally prepared and equipped to have a role in preventing antimicrobial resistance. This depends upon the level of education and the content of antimicrobial resistance covered in their respective curricula. In order to make sure that staff are equipped as possible, toolkits are available to help pharmacy staff have effective conversations with patients. When patients encounter an upper respiratory tract infection, they should consult their local pharmacy in the first instance, as pharmacists are the expert to identify the most appropriate treatment for their symptoms, including referral to a physician. I think symptomatic relief is essential. There is a need to combat the misconception that patients want antibiotics and recognize what patients actually need. Patients should be guided towards symptomatic treatment, which can provide fast and effective relief. The Global Respiratory Infection Partnership's 5P pentagonal framework, its 1-2-3 approach, and associated toolkits and resources for prescribers, pharmacists, and patients serves as a blueprint for dialogue on the rational use of antibiotics in upper respiratory tract infections. These resources may be found at www.grip-initiative.org. Patients experiencing upper respiratory tract infections should, in the first instance, consult their pharmacist as the first point of call for symptomatic self-management.